All right, let's dive in. Today, we are taking a guided tour through the really complex world of personality disorders. Now, this is a topic that's often wrapped up in a lot of confusion, so our goal here is to cut through that noise with some real clarity and compassion. Let's get started.
To kick things off, I want you to think about this question. What happens when our personality, the very thing that makes us who we are, stops feeling like a home and starts feeling more like a prison? When those patterns become so rigid, they actually trap us. That's really the heart of what we're exploring today.
So, what exactly is a personality disorder, clinically speaking? Well, it's not just about being quirky or having a bad mood. The official definition points to a long-term, lasting pattern of thinking, feeling, and behaving that's really different from what's expected in a person's culture. And here's the most important part. It has to cause significant distress or get in the way of a person's ability to function. That's the key.
So here's our game plan for today's tour. First, we're going to decode how these disorders are even organized. Then, we'll visit the three main clusters, A, B, and C. And finally, we'll pull back for a big picture recap to make sure it all clicks together.
Okay, so to make sense of this whole landscape, clinicians have grouped the 10 main personality disorders into 3 buckets, or clusters. The best way to think about them is like different neighborhoods in a city. Each one has its own unique vibe and set of characteristics. This system just makes it so much easier to understand their core features.
Our first stop is Cluster A. This is the neighborhood often described as odd and eccentric. The disorders you find here are all about patterns of thinking and behavior that might strike others as unusual, maybe a bit suspicious, or just socially disconnected. First up, we have Paranoid Personality Disorder. The name says a lot here. The defining feature is this deep, pervasive distrust and suspicion of other people. Someone with this disorder might feel like everyone is out to get them, which makes them constantly on guard. Treatment, like cognitive behavioral therapy or CBT, is all about helping them challenge those deep-seated beliefs. Now, it's really important to see how this next one is different. With schizoid personality disorder, the social withdrawal isn't driven by fear, it's driven by a genuine lack of interest. There's a strong, consistent preference for being alone. This, as you can imagine, makes therapy pretty tricky, because the motivation to even connect with a therapist can be really low.
And to round out Cluster A, we have Schizotypal Personality Disorder. This one kind of combines that social detachment with some really unique ways of thinking. We're talking about magical thinking, like believing you have psychic powers, or having ideas of reference where you feel like a random news story is a secret message just for you. It's this blend that makes it so distinct, and treatment often involves both therapy and medication.
All right, let's head over to our next neighborhood, Cluster B. And I'll tell you, this is where the emotional volume gets turned way, way up. This is the dramatic, emotional, and erratic cluster, and it's all defined by impulsivity, really intense emotions, and often unpredictable behavior. First in this cluster is Antisocial Personality Disorder. The absolute core feature here is a complete disregard for rules, social norms, and the rights of other people. This can look like manipulation, deceitfulness, impulsivity, and here's the real kicker, a profound lack of remorse for any of it. This makes treatment incredibly challenging because the person often doesn't believe they have a problem.
Next up is Borderline Personality Disorder, or BPD. The engine-driving BPD is an absolutely terrifying fear of abandonment. This fear fuels everything: the unstable relationships, the wild mood swings, the impulsivity. But, and this is so important, there's a huge note of hope here. BPD is considered the most treatable personality disorder, thanks to a therapy called Dialectical Behavioral Therapy, or DBT, which is incredibly effective. Now, if the core fear in BPD is being abandoned, the core motivation in histrionic personality disorder is the fear of being unseen. This creates this powerful, pervasive need to be the center of attention, which often comes out as theatrical, dramatic, or emotionally exaggerated behavior. It's all about capturing and holding that spotlight.
And finally, in Cluster B, we have Narcissistic Personality Disorder. On the surface, it's defined by this huge sense of grandiosity, a constant need for admiration, and a real lack of empathy. But here's the paradox. Underneath all that bluster is an incredibly fragile self-esteem. And that's exactly why treatment is so rare. Admitting you need help would mean admitting a vulnerability that the entire personality is built to hide. It's worth pausing here for a second because people mix up BPD and NPD all the time, but they are fundamentally different. Let's put them side by side. BPD is driven by a fear of abandonment. NPD is driven by a need for admiration. And look at the result. BPD is the most treatable, with great tools like DBT.
NPD is one of the hardest to treat, mainly because people so rarely seek help in the first place. Okay, on to our final stop, Cluster C. This is the anxious and fearful neighborhood. The common thread that ties all of these disorders together is this overwhelming sense of anxiety, of self-doubt, and a life that's really governed by fear.
First up here is Avoidant Personality Disorder, and the central conflict is just heartbreaking. It's this deep, genuine desire for connection that's constantly being sabotaged by an intense fear of rejection. This hypersensitivity to criticism makes them feel inadequate and avoid social situations, even when they're desperately lonely.
That fear of rejection shows up a bit differently in dependent personality disorder. The core motivation here is a deep need to be taken care of, and it all stems from a profound fear of being alone and unable to cope. This is what drives the submissive behavior, the clinginess, and the constant need for reassurance from others to make even simple decisions.
And last but not least, we have to make a really important distinction. Obsessive-compulsive personality disorder, or OCPD. This is not the same thing as OCD. OCPD isn't about specific rituals, like hand-washing. It's a pervasive pattern of personality defined by a preoccupation with order, control, and a level of perfectionism that's so intense it actually prevents things from ever getting done.
Phew! We've made it through all 3 clusters. That was a lot of ground to cover. So let's just take a step back for a moment and look at the big picture, just to make sure the whole map is clear in our minds.
And really, this table gives us that perfect 30,000-foot view. It lays it all out. You've got Cluster A, the odd and eccentric. Cluster B, the dramatic and erratic. And Cluster C, the anxious and fearful. This is the simple, organizing framework that clinicians use, and it's probably the biggest takeaway from our entire tour today.
So why do we even have these labels? You know, this quote from Confucius really gets to the heart of it. The point of a diagnosis isn't to slap a label on someone or to stigmatize them. It's about giving a name to a pattern of suffering so that we can begin to understand it. It gives everyone a common language and hopefully a path toward getting the right kind of help.
And that really brings us to our final thought. Now that we've got the clinical framework, the real question is a human one. It's this. Beyond all the labels and clusters, how can we use this knowledge to foster a little more genuine understanding, a little more compassion for the incredibly complex inner worlds of the people all around us?